All right, your next bite registration is using putty. We've talked about putty being in color coordinating containers. You never interchange the scoops. They always go with the lid color. So if this was brown, you'd have a brown scooper. If this was white, you'd have a white scooper, okay? So it's really nice to keep them organized. You don't want to interchange them. Putty has a very oily type appearance, and I'm going to use a lot just so that you guys can see this, but you'll need like half of this amount. We're only doing a mandibular, or we're only doing an anterior quad, which gets placed on the mandibular. Take one ball of the material. For this lab, it will probably be pre-measured out for you, so you guys don't worry about scooping it out, and so it also keeps the students from using too much material. You take this and you knead it together. You can't dilly-dally. Make sure all the yellow and the green are incorporated. Because this stuff, when it decides to set up, it sets up. Now, I know just because I've been doing this a long time that this material is getting pretty firm. I also know that I have too much, so I'm going to take half of it and just set it aside. I am only doing an anterior. I suggest you make like a big fat slug. You're gonna go over here to the canine and you're gonna just pull it over into place to the other canine, which I'm extending it a little bit far. Now you instruct the patient to bite down in centric relation. It is imperative that they bite down in proper occlusion. One of the ways you always check to make sure that they are in centric relation is have the patient open, close, so that you're aware of how their teeth naturally come together. Also, if they're biting funny for you at all, if you give them a hand mirror and have them open, close in the hand mirror, they'll see that they're not biting correctly for you. Oddly enough, as soon as you put stuff in people's mouths, they bite and close in these weird ways that they never would normally do. So that's your job to check that. This material will set up pretty quick. It's kind of fun to play with. It reminds me of silly putty. I have my little extra as my indicator actually over here off to the side. It worked out quite well for me to have that indicator. Now with this material, you would instruct the patient to push their tongue forward to help squeeze the material into place, and their lips would be around the material. That's something I didn't mention on the blue mousse material. The blue mousse, their cheeks would help push the material in also. All right, I feel that we're set up. This one tends to be pretty sticky sometimes for patients to open. But of course for me, it's not gonna do a snap like I thought it was going to. I'm gonna pull the material out. Make sure that there's no excess material. I forgot to have you guys dry the occlusal when we go to place the putty, but you guys are aware of that by now. This is Toothless Timmy. And we can see that we have the incisal edges to the canine. I actually got a premolar over there. That is okay. Getting molars is not acceptable though, because that is not a quad. Okay? You would rinse this off, place it back into the patient's mouth. Make sure they're in proper occlusion. Looks good to me. Take it out. And then you would disinfect it just like you would any other bite registrations following manufacturer's instructions. You would bag it just like you would with other things for lab, going to the lab case. All right, that's putty.